when you have a muscle injury, massages are actually contraindicated. You should not have a massage. Hi, I'm Dr Pabrinder Kaur. I'm a sports physician at Pantai Hospital, Kuala Lumpur. So today, I'll be answering some questions that you may have, and hopefully my answers will help you understand sports medicine better. Who is Dr Pabrinder Kaur? I'm a sports physician and I manage pains and injuries of the muscles, bone, joints, ligaments, and tendons. Basically injuries that do not require surgery. What's the difference between a sports physician and a physical therapist? So this is a question that I get quite frequently. As a sports physician, I have a medical degree and I undergo master's training in sports medicine. I examine the patient as a whole. I do a full physical examination, history taking. I'm able to prescribe medications and also provide pain relief by oral medication or by injections. I also inject for regenerative therapy. I understand all illnesses that a patient might have, like medical illness or surgeries that have undergone. So I'm able to prescribe an exercise by taking into consideration the precaution that's required. Who does Dr. Pabrinder see? So a common misnomer is that sports physicians only treat elite athletes, and this is not true. I treat the general population as well, mostly the general population, people who are active in any form of sports, be it racket sports or gym goers. I also treat people with work injuries, so people with occupational injuries, for example, chefs, and also as well as the elderly population, people with knee osteoarthritis, any form of degeneration. What medical tool does Dr. Pabrinder use? The main difference between a sports physician and other doctors is that I use a lot of ultrasound in my practice. I use ultrasound for mainly two reasons. One is for a quick diagnostic to confirm the diagnosis and have a quick look and see what you have. This is to complement my physical examination and clinical diagnosis. And another reason that I use an ultrasound a lot is that all my injections, whether it's for pain or it's for regeneration or for healing, I use it by using ultrasound guidance so that I target the specific site that has problems. What are the most common injuries that Dr. Pabrinder treats? I treat a lot of joint pains, muscle pains, ligaments and tendons as well. So it can be knee, shoulder, ankle, foot, back pains. So those are mostly the injuries that I treat. What are the most avoidable physical injuries? Most injuries are avoidable, but I always give this advice to everyone. The first thing is have a training program. You must always have a training program where you escalate your exercises. Number two is know your sports. Understand the sports, understand the techniques, understand the risk, and also understand how to prevent injuries and know your equipment well. Lastly, you have to know your body. You have to have very good physical condition, mental health, nutrition, and hydration status. Currently today, one of the avoidable injuries in, for example, football would be ACL injuries. And in ACL injuries, we have a prevention program called the FIFA 11+, which you are encouraged to do at least 2 times a week to reduce the risk of anterior cruciate ligament or ACL ligament tears. Which sport has the worst injuries? There's no specific sport with the worst injuries. I believe that every sport can have bad injuries, but high-risk sports such as skiing and motorsports can cause injuries such as brain injuries or neck injuries, which can cause you to be in a coma or paralyzed. But again, the most important thing to know is that in every sport, you must take precaution. What are the most common injuries found in badminton players? Commonly, I get badminton players with shoulder injuries or with foot and ankle injuries. Once again, to minimize the risk of any injuries, you have to know your body, know your sport, as well as have a training plan. Do massages treat muscle pain permanently? So you must understand that when you have a muscle injury, massages are actually contraindicated. You should not have a massage. Massages can increase risk of tear, increase risk of bleeding. However, if you do have a little bit of muscle soreness or muscle spasm, you can actually opt for massages just to relax the muscles or for your general well-being. That's all that we have for today. If you have any questions, feel free to leave it in the comments below. Thank you.